Hello everyone, and welcome to this week's message. April is Occupational Therapy Month, and my special guest this week is Barbara Hooper, the founding program director and division chief of the Occupational Therapy Doctorate Program here at Duke. Barb is here to discuss the goals and some of the misconceptions about occupational therapy and about what sets Duke's program apart. Before we talk to Barb, I'd like to share a few updates. The Dean's Distinguished Research Series concludes on April 20th with talks by two exceptional faculty members, Kimberly Johnson and Lisa McElroy. The sessions thus far have given us exciting insights into the extraordinary research being done here at Duke, and this one will be no different. The event is open to the entire School of Medicine community, and I encourage you to attend and hear firsthand about some of the exceptional research our faculty are doing. And I want to remind you that nominations are currently being taken for the inaugural Dean's Staff Awards. These annual awards in 4 categories is to honor exemplary staff who support the School of Medicine's mission and values. I encourage you to recognize your outstanding colleagues by submitting nominations, and I look forward to this new opportunity to celebrate these distinctive contributions. Finally, I want to express my gratitude to the many people who played a part in Duke's COVID surveillance testing operation, which ended last month after almost 3 years and nearly 1 million COVID tests. Our innovative surveillance process enabled us to continue most education research activities throughout the pandemic, and it helped make Duke a national model for successful pandemic response. It required the tireless effort of countless faculty, staff, and students. So on behalf of the School of Medicine, thank you. And now I'd like you to join my conversation recorded earlier with Barb Hooper. Barb was selected to establish and lead our Occupational Therapy Doctorate Program because she had the experience and vision to create something special. Barb, the faculty, staff, and students have created an innovative, forward-thinking degree program at Duke that is re-envisioning what occupational therapy is and how it is taught. The program welcomed its first cohort of students in August of 2021. That inaugural class will graduate next spring. Currently, the program has a diverse enrollment of 80 students, and the newly admitted class of 2026 will begin this August. Barb, thanks for joining me today. So, as I know, this month is Occupational Therapy Month. So what do people need to know what occupational therapy is? Particularly, how does it pertain to their health?
Well, what a nice way to start Occupational Therapy Month. Thank you. Yes, people need to know that occupational therapy works with people who, for any number of reasons, struggle with carrying out their daily lives, whether that's caring for themselves or caring for others, caring for their environments, or engaging in their communities. When those things that structure our lives get interrupted, then that affects our health. And so occupational therapy works with people to keep them able to participate in what they need to do and want to do.
So Barb, what's a common misconception about occupational therapy?
But the name is one common misconception. Right. Occupational therapy, people tend to think that we get people jobs. And what's helpful sometimes is to understand that the word occupation actually, before it meant job, meant to be occupied. And so you can think about OT as the therapy of being meaningfully occupied or helping people be meaningfully occupied, because that's a key factor and help determinant.
So you had the very challenging task of setting up a new program, but that creates opportunities, and I think you approached it wanting to do it a little bit differently. So what were some of the approaches you took that are different from other programs?
Yeah, it's been an amazing opportunity, and I feel so fortunate to have the opportunity. So yes, we at Duke OT, Duke gave us the opportunity to kind of reimagine OT education. So at Duke, OT students don't focus so much on the subspecialties of the field. Rather, they focus on studying, as I've said, the complexities that go into people being able to do a day. And they look at the complex systems that have to come together to keep people engaged, to be successful in what they want to do each day. They also realize that it's everyone's human right to do their days the way they want and the way they need to do them.
So you really developed the program through a lens of equity.
equity, we call it occupational justice, i.e. the right to being meaningfully occupied, the right to access daily activities, whether it's food, for example, or work, or or everybody having a seat at the table. It's about.
Thank you for doing that.
Yeah.
But the other challenge you had is recruiting the first class. And again, you took a bit of a different approach to how you engage potential applicants.
Yeah, and again, inspired by what all has been put in place at Duke, we wanted to come at admissions from an equity standpoint, and so we tried to remove as many barriers as possible to applying to occupational therapy program, and that included some experimental admissions policies, like not requiring specific prerequisite courses.
That's interesting.
And because we came to think about really what we want is prerequisite understandings. And so let's say, for example, anatomy and physiology, traditional prerequisite.
Mm-hmm.
But these days in undergraduate, you learn about the human body in a whole bunch of different places. You can learn about the body in a dance class, and it'd be pretty powerful. So we kind of took out the specific way they had to learn about the body and just said now the prerequisite is knowledge of the human body, and they have to show us where and how they did that learning.
And clearly you were able to do that and get through accreditation. So you thread a needle with doing that.
Yeah, and we've been able to admit really robust classes.
And you invited me to welcome the first class, and it was such a pleasure to see such an amazing group of individuals, and I know very diverse individuals. Just so excited to be here. So what excites you about the next phase?
Yeah, the next phase, I'm very excited about continuing to grow this program, continuing to grow our innovative collaborative partnerships at Duke, and taking advantage of those opportunities at Duke and creating connections. I'm also very excited about what our students are going to go out and do, because I really think, as you know, that healthcare in the last decades has now come to embrace daily living and meaningful and meaning in life as a determinant of health. And so that is really aligned with where OT has been for a long time. So it really brings OT as a prominent team member in health and well-being in society. And that's exciting.
I love the idea that health is a team effort, and really focusing on health as opposed to disease. So really exciting.
That's right, and that's a really big part of Duke OTD program, is students learning that health and well-being are much more than the absence of disease or the absence of impairments from disease, that health and well-being really are about staying engaged in things that give life meaning.
Great. Well, thank you so much, and congratulations.
Thank you.
And to everybody else, thanks for all that you do, and have a great weekend.